To introduce our final speaker this session, Scott Alderman, who from the New York State Department of Health, who's been a great partner in steering our research for protecting drinking water. So, Scott.
Thank you, Chris. Thanks, everybody. Thanks for having me. How about another round of applause for CCWT for putting on another great symposium, right? Great host, successful event. I've been trying to figure out what the heck I'm going to say about why it is I'm on the stage. And I'm wondering if it wasn't a mistake that Tim didn't introduce me, because I'm the regulator, right? I'm the guy that he's maybe swearing about on a regular basis. I'm the Assistant Director of the New York State Department of Health Bureau of Water Supply Protection. And what that means, or one of the reasons why I'm here, is that the Bureau is responsible for enforcing the Safe Drinking Water Act, obviously in concert with our county partners, who I see in the back of the room. It's good to catch up with you guys. 5 hours away from home, but it's been worth the trip. So that's kind of why I'm here and what I see, how I fit in this whole picture, this whole mosaic of presentations. It's an honor for me to be here, see all these excellent technical presentations, very brilliant people, capable people, and now I'm going to bore you with 15 minutes, probably 10 minutes of regulatory update. This slide, and I guess I'll preface by saying the whole slide deck is something that it's kind of our roadshow. One of the responsibilities that we have as a regulator is not just to come up with regulations, but also to inform the regulated community about what they are, how to comply with them, what's the timing. So that's part of what this is a small piece of that larger presentation. I left this in here only to show the amount of regulation that we're up against currently in New York State. Like, we're currently working on cybersecurity regs that the federal government has initiated, but the state took the lead in implementing some specific state cybersecurity regulations to protect water and wastewater infrastructure from cyber vulnerabilities. So we're doing that while we're also working on lead and copper rule improvements, which by the title is an improvement on the lead and copper rule to reduce lead exposure in drinking water. Obviously, we have the EPA PFAS rule that has been referred to a few times during this this platform. We've also got consumer confidence rule. We're also trying to strengthen sanitary surveys and understanding the condition that our water systems are in, and we also administer funding. So we have a large portfolio in the Bureau of Water Supply Protection, a lot of responsibilities. I'm going to focus on, obviously, for this panel discussion, the PFAS rule. I also left this one in here too. It's a diagram that our director put together to just kind of highlight what regulation means, I guess, for us, for our county partners, and for the regulated community. What you see here is a number of dates and responsibilities of things that water purveyors have to do, or dates that we have to come up with guidance for certain things. A lot of the things that you see on the screen are related to lead and copper rule improvements, but there's also, like I said, cybersecurity in there. There's the EPA PFAS rule. So I just think that I like this slide because it just shows. I mean, you see the sheer volume of dates and things that we have to put together, which is why folks like Tim are swearing at us on a somewhat regular basis. Acronyms got to be in there for a good bureaucrat. Got to have my acronyms in there. All right, so deep breath. Let me preface what I'm about to show you with the EPA PFAS rule is a very fluid situation, right? It's been changing frequently. I could probably give over an hour on the story of the PFAS regulation. So I'll just say a lot of the stuff that's in here, this is how quickly things have moved. It's already kind of antiquated, but I'll just try to focus on what the rule is right now. And I know that there's been reference to a new proposed rule, but at this time that rule is just proposed. So this is the existing rule that's in effect, the existing national primary drinking water standards for PFOA, PFAS at 4, and this was promulgated by the federal regulation on April 26, 2024. And then it's PFHXS, NA, Gen X at 10 parts per trillion, and then the hazard index, which was created in order to assess additive effects of different PFAS compounds. So that is currently the federal national primary drinking water standard, or are the standards for PFAS. So what we've been focusing on, and again, that rule still being in effect, along with the 10 part per trillion regulation that we currently have in effect at the state level. The way the Safe Drinking Water Act works is that when you promulgate a regulation, it's typically a 3-year time frame. You get promulgation, and then there's 3 years that you afford water systems the ability to come into compliance. That's what they did here for most of the rule, where 3 years after the publication, there was going to be requirements on initial monitoring. Initial monitoring had to be completed to inform what your compliance monitoring was going to be, starting in April 2027. And then also reporting in annual water quality reports. So the only thing that didn't stick to that 3-year time frame was the MCL determination, right? And so trying to describe to folks the difference between an effective MCL, which we currently have at 4 at the federal level, and an MCL determination. They're two different things, right? The MCL is effective, but water systems aren't required to make a determination on a violation of an exceedance of that standard until 2029, again, under the existing rule. So now let me throw all that out the window and say what I can kind of say at this point. Since April 2026, the rule has been challenged. There have been legal challenges to the rule, both procedural challenges to the rule and content challenges to the rule. And I could easily do a 30-minute presentation on the motions, counter motions, the parties, who they supported, who they didn't, and how that's changed with time. I won't do that now. What I can say is that all of that has kind of culminated to last month, the EPA proposed regulations that are consistent with what they've been signaling they would do since the litigation started. And what they proposed, and again, this slide is a little antiquated. We obviously put these together before EPA dropped the proposed regulation. But the new proposed regulation, which they dropped on May 20th, has them retaining the MCL at 4 parts per trillion for PFOA and PFAS, consistent with the current rule, but rescinding the MCLs for the other compounds and rescinding the hazard index. So that's currently what's out there. And then there's another proposal to extend the 2029 compliance determination date out to 2031, and that is related to some exemption or extension provisions that are currently available in the Safe Drinking Water Act. So what does that mean for us? I mean, I guess as you can imagine, for us, for the water purveyors, it's difficult for us to come up with guidance that we need to be coming up with to give to systems when the landscape is constantly shifting. So what we've been trying to focus on is the initial monitoring, because that's still in place. That's going to have to be done by April 2027. The whole idea behind it is to understand the contaminant levels. We've already got a pretty good start on that in New York State, since we've had regulations in place since 2020 for PFOA and PFAS. And just focusing on messaging to the regulated community, get your initial monitoring done, take your samples in these locations, and then inform your compliance monitoring based on that. And then the compliance monitoring, essentially once you have that in place, the idea is that you're going to take a look at where you shake out with respect to detections. Are you surface water? Are you groundwater? That's going to inform what your sampling schedule is going to be in order to determine what your MCL determination might be once we figure out when that's going to be required. And I think I'll just kind of go quickly. Again, so the MCL compliance determinations aren't going to be in place until 2029 under the current regulation, potentially 2031 for the proposed regulation, but there's still some work and some clarity that needs to be made with that provision. And I'll just wrap up this slide because I feel like I'm definitely losing the room with these regulatory standards. And again, this is somewhat antiquated. We expected that the EPA was going to propose a rule. We didn't know what the exact timing was. since we put this slide deck together, they did that. And as they had indicated, they're retaining the standards for PFOA and PFAS at 4. So that's going to continue to be, and that messaging hasn't really changed since 2024, and maybe even before that. The number for those two compounds is going to be at 4. It's going to stay there. What happens with the other compounds, yet to be determined. I think I've kind of been given a gag order, and I'm looking to my boss in the crowd as far as how the state might handle those additional compounds. I will recommend anybody that has found this presentation interesting, quiet room, to go ahead and watch the Drinking Water Quality Council meeting that is on Monday of next week. I think we'll be it's a different forum. It's more of a forum for us to articulate what our current situation is and what our plans might be. And with that, I'll just close, and I wanted to say this at the outset. So really, joke, what am I doing here, right? What is my role in here? And it really has been a privilege of mine to work with the center, because I feel like we've worked together since the inception. The health department, certainly while I'm around, is always cognizant that regulation has cost, right? We never want to be in a position where we're just regulating for the sake of regulating and not understanding what the implications will be for the regulated community. So I think the partnership that we have with CCWT, the foundation of that has always been, here's the issue, what do we have available for treatment? Because treatment is a big piece of compliance. It's a big piece of MCL determination. And so I think that's really where we've come together, the nexus, by design. And from the beginning, it was always a pleasure working with this group and developing or understanding better AOP treatment technologies and what was going to be available, and getting that to the water purveyors. And we're doing the same thing now with Lokesh and his group. It's really a privilege of mine to sit in on the monthly meetings that we have to understand the work that you guys are doing. And not just from an academic standpoint, right? I mean, it's like truly understanding it to help provide tools to water purveyors as we're regulating. And so I guess my parting words would just be, that's important to New York State. That's important to the health department. And clearly it's important to New York State, because we're making an investment in this co-op. And I think it's served both of us pretty well over the years, and I look forward to that continued cooperation. So thanks, everybody.